People's Platform.
Good evening and welcome to the People's Platform. In a world increasingly shaped by crises, both natural and man-made, we are witnessing climate change escalating into a global health emergency where its impacts are daily realities, especially for the most vulnerable. From landslides to floods and droughts that displace communities and spread disease, the climate crisis is not only a threat multiplier, but is also a profound humanitarian concern. In South Asia specifically, the intersection of climate and health raises urgent questions about preparedness, equity, and justice. What urgent action must the region take? How can we collectively and pragmatically undertake to leave no one behind? I'm so pleased to be joined by Farhat Mantoo, Executive Director, Médecins Sans Frontières, Doctors Without Borders, MSF South Asia. Good evening and welcome to the show.
Thank you, Sonali.
You just wrapped up a two-day climate health roundtable to discuss the significant and growing challenges that climate change poses to public health, particularly for vulnerable populations across the South Asian region. You yourself have, throughout your career, advocated for greater equity and justice, and you have the unenviable task of doing this in a backdrop of a warring, broken, and polarized world. To kickstart the conversation, I'd like to ask you to take us through how MSF has successfully managed to overcome existing systemic barriers and obstacles to create meaningful action with respect to different initiatives, and also speak to us about some of the takeaways from the two-day roundtable.
Thank you. Actually, you asked me something to sum up that was so rich for 2 days and the collective wisdom we had in the room and hopefully how we carry it forward. But let me go a step back. MSF, Médecins Sans Frontières, is a medical humanitarian organization. And why do I say so? It's made of people like you and me. Mm-hmm. It's people who believe in international solidarity, who believe in humanity, who believe everybody deserves access to healthcare in a dignified manner, is something that helps us cruise every day. So if you ask me, how do we navigate this space? It's not only MSF, it's how do you navigate this space on a daily basis. So to start with, if we look at what were the key outcomes for me or key takeaways for me out of these 2 days? The first thing is that if we talk about climate and health, the intersection of that, it is now hitting us hard where it hits the most. That's our own health. Mm-hmm. And imagine we are the ones who are privileged in many ways because we have access to health. We can afford health. But talk about the vulnerable population. Talk about the most excluded. This is something that is impacting them like anything. And MSF works in those locations all around the world. In South Asia, we work in India, we work in Bangladesh, we work in Pakistan, we work in Afghanistan. We work with people on the move. We work with people living with HIV, TB. We work with people with hepatitis C, but we also work with people who are in the lowest strata of the society. So these are people who cannot have access, are the ones who are in the front line of this climate crisis. So they are the ones who have done least in contributing to that and are the ones who are impacted most. So in this backdrop, I think we all as individual citizens of different countries around the world, and being a global citizen, we have responsibility to bring all the minds together to look for solutions. Yeah. MSF, I told you we are a medical organization, so that would mean that we do not have the expertise in the space of environment and planetary health. But what we have is like first-hand experiences of what our doctors, our nurses see on a day-to-day basis in the project locations around the world. So what we decided is to curate these 2 days where we will get a lot of variety of stakeholders, from academia to policymakers to practitioners to individuals who believe in climate justice, climate activists, medical students, artists. We brought them all together with one hope, that what we do is like we learn from each other. We bring the solutions to the table. So there was a lot of cross-learning. So if you look at South Asia, the problems in the region are more or less same, but the solutions may not be same. Mm-hmm. So our first very minor success, but I feel it's very important, is that we had an exchange of models that have been successful. We learn from each other's failure. We learn from each other's success. So in the room, we had experts from Sri Lanka, from India, from Pakistan, all the way to UK, from Bangladesh, talking about how they have dealt and found localized solutions and some success stories. We had policymakers talking about the gap that is there and what they have been trying to do at the micro level and the macro level. So knowledge transfer, that was one. Then cross-pollination of ideas, that was two. A movement we wish to start from these 2 days and hope that it goes all the way to various platforms, national, global and international, where we urge the world leaders, people who have influence, to be able to make the change. We want climate crisis to be addressed.
Thank you for that. A phenomenon that we often encounter in great initiatives across disciplines, across jurisdictions, is how commonly this work is done in silos. There is very little knowledge sharing, resource sharing. And when we were discussing this off air, you spoke about this concept of open science, which is the movement to make scientific data, research, educational resources, and publications freely available to everyone without barriers. And you were talking about how this practice and discipline needs to be incorporated into social sciences as well. How can we make this work? Because it's such a fantastic idea.
So COVID was something that really taught all of us something very, very interesting. Because until the COVID did not hit different parts of the world, we knew about concepts of accessibility and affordability. But at the time of COVID, sometimes we had money, but people struggled for hospitals, they struggled for drugs, they struggled for access to health. It was no more that somebody could not afford healthcare. So in that backdrop, there were many scientists, academicians that came together and said, you know what we want to do is actually, we want to bring the knowledge together. Say, you have trialed an idea and it worked. So keeping it in the public domain so that somebody can actually build on this one. So it is building on the principles of collective wisdom. It is building on each other's success and failure. If you have tried something and it was not successful, why should somebody repeat the same cycle? So keeping that philosophy in mind, I hope that we are able to copy, because I would in this case say, let us shamelessly copy, because it will save the time for the world, because climate crisis is not going to happen tomorrow. It has actually happened yesterday. So let us not live in this illusion that this is something that is a problem that is facing us in future. It is a problem of yesterday, which we should have acted upon yesterday. So we don't have the luxury of time. So with whatever time we have, what we are asking for is actually getting people together in one room and saying there is merit in individually doing things, but there is also merit and power in doing them together. And these 2 days is actually an attempt to that direction, where we did not only bring in doctors in the room. We believe that it's an intersectorial coordination that is required, because it's not just one part of expertise that is required. So it is different heads coming together. So we had people coming in from the sector of agriculture, we had water and sanitation, we had public health, we had professors, we had artists, we had student activists. We also had young students talking about hackathon, so using technology. So there were so many different aspects that came together, and if we put them together, you will be able to build a beautiful tapestry that is needed to make progress. Otherwise, what we are doing is like we are acting in silos, and we may make micro impact, but climate crisis doesn't respect boundaries. It doesn't respect borders. So we cannot say it's happening somewhere in China, India or so. It's going to happen it's going to happen in our backyard. So why not be proactive and join hands in this case and use this concept of open science and extend it to other branches of, I would say, learning to make the progress that's needed.
Farhat, across the world, we're seeing the emergence and mainstreaming of harmful narratives, the deprioritization of rights, the defunding of causes which are important, the marginalization of vulnerable groups. So it is in this backdrop that we need to advocate more and more for governments and civil society and business leaders and communities to come together, to work together, to converge towards ensuring that we mitigate climate impacts, that we adapt to the harmful impacts of climate change and health concerns. How do we go about doing this in a systematic, mainstreamed manner?
You know, I'm going to take you to something which actually is something that inspired me. Okay. Because rightly you mentioned and you actually pictured the world as it is today. We are currently trying to find meaning in a context globally where we know that there are policy shifts. Certain key areas which are essential for humankind are being deprioritized. We are looking at harmful narratives that will actually not only kind of prompt us to not make any progress, but actually lose all the progress we have made in all these years. We also see that there are aid cuts happening around the world. But in all of this, I will take you to something which in the year 2024, there was this group called Articulation of Indigenous People of Brazil. So they launched a global campaign, and the campaign was titled "The Answer Is Us."
Okay.
So that's what I say, that history tells us, it teaches us, it helps us believe and have hope. So when I say so, what does it mean? Is that the world has seen many, many complex crises. They have seen policy shifts. The world has seen harmful narratives come and go. Mm-hmm. But civilizations have survived because there is somebody who has hope in humanity. So in such a context, it's a space where traditional leadership will be replaced by a different leadership. And that's where I would ask a country like Sri Lanka, a region like South Asia, to demonstrate that leadership and take the space that is there, which is a vacuum which is created by how the traditional peace brokers, the traditional global leaders kind of have left the space very unsettled. So this is an opportunity for nations of South Asia to be able to demonstrate that leadership in saying, you know what, we care for the world and we are going to do our bit for it. And the first step is that this region comes together and actually looks at the problems collectively and looks for solutions collectively. Mm-hmm. So now going a bit back, so how do we survive? The world is not getting a better place. So let's be very clear about it. And when I say so, I do not aim to paint a picture that is very sad, mm-hmm. But I'm painting a picture that is realistic. We are seeing that there are more and more conflicts around the world. We are seeing a resurgence of many diseases that we felt that we have addressed. We are talking about climate conditions that are more severe, that are more frequent. So it is not that before 2020 there would not be droughts, there would not be floods, there would not be earthquakes. They would always happen. So that's history. It would always happen. But now if you look at the severity and the frequency of it, and what is that doing to people like you and me, and especially people who are the most vulnerable, their livelihoods, their health, any progress they make is taken away from them. So what would happen is, like, I'll give you an example that a long time back I visited a place in Assam. There is this river, Brahmaputra river, mm-hmm. and this river is famous globally for these small islands. And these it is one of those river that has islands that disappear and appear. Mm-hmm. It's a phenomena, and many of these islands are having people living on it. So what would happen in the past is, like, they would see 1 or 2 floods in a year, but now it is so frequent that the islands keep on appearing and disappearing. So then you ask yourself, people are resilient enough. So when I visited these islands and I asked people how they survived, they would always find a way to survive.
Right.
So they would not rely on aid to come from somewhere. They would help each other. So that generosity, that solidarity, that helping is very much prevalent in our societies. It is just how do you bring that together?
Globally, we are also witnessing the rise of incel culture, polarization between genders, an increase in femicide, a rise in desensitization the world over. Women are disproportionately impacted across the board. Can you help us understand climate, health, sexual and reproductive health and rights from a gendered lens?
Not at the risk of kind of sounding alarmist, I believe we are in an age where women are under attack. See it SRH, sexual and reproductive health rights, see the ban of education, see restrictions that are happening world over, be it Yemen, be it Afghanistan. Look at gender-based violence in Sudan or Haiti, and you see who are the ones who are most impacted are women, are young girls. In a backdrop where we already spoke about the policy shifts, where less and less aid is being given to women health, where we see that the investment that is required is reducing by the day. We are in such a reality of today, and we are talking about more than half of the world population. And being a woman, I believe woman is the cradle of civilization. So a healthy woman is a healthy home, and a healthy home is a healthy planet. So climate and health is very interconnected to the health of women. As somebody who really manages the household, to somebody who is taking on responsibility when the men in the family go to cities to work, woman holds multiple forts. And in the context we are in, we see that the space is being restricted by the day. Their rights, their health, their education, investment in them is something that we are seeing a pattern, and unfortunately that is a pattern we are seeing more and more all over the world. So that's one thing that we all need to make sure that we have attention to it, and we do not let invisibility gain power over it. So we have to keep on talking about it. So when we sit in the room, nobody should accuse you and me of being women and we are talking about women. Irrespective of the gender we have, we should be talking about women, because I believe in that. If woman in the house, in the society is not taken care of, that is not a healthy society, because half of your society is sick then. So it is important for the future generation to be kind of reminded through education, because it's also about what you teach in your home, what you teach in school, what you teach at universities. That has an impact on the growing, I would say, misinformation, disinformation that you see, especially because of the technology. Because you can control the narrative in the house, you can control narrative in certain spaces, but now you have this big web where the narratives are sometimes the ones who are building those narratives are hidden. You do not have, under the veil of anonymity, you don't see the people, and they do more harm. So what do we do is like, how do we educate and sensitize from the very young age, both boys and girls? And it has nothing to do with that we only need to educate girls or only boys, everybody, about all the topics that matter. So I would say education is the key. Any society is a healthy society if they invest in two things. One is education and one is health, and I'm a believer in that.
Beautiful. Farhat, your PhD is in psychology, and I must ask you this question. In your experience, how has the perception of mental health evolved in humanitarian responses in South Asia? What kind of role does MSF play in breaking the silence around trauma, grief, psychological resilience? And in the South Asian region, we see countries that have been ravaged by conflict, natural disasters, man-made disasters. We see how communities are divided, where there is a trust deficit. So speak to us about how mental health awareness and investment into mental health plays a huge role?
Thank you for asking this question, and not because it's a topic that's close to my heart, because I really feel that, to start with, when we talk about climate and health, we talk about communicable diseases, we talk about neglected disease, but we don't talk about mental health. I am not sure how our audience is well versed, but we are talking about things like eco-anxiety. We're talking about environmental stress. Just imagine if you do not have internet on your phone for 3 hours, that even generates anxiety. Yeah. So we are in a state where we have to look at how climate is playing a role in mental health. Right. But taking a detour to what you asked me, as a medical humanitarian organization, we very early on recognized the importance of overall well-being. And that is where I would say 2 decades back, our team started to integrate psychosocial well-being as a part of our projects all around the world. Okay. And initially what we experienced, I'm sure it is still in many parts of the world, is that the psychosocial care or the mental health was only understood in terms of psychiatry. And we had to take a journey where we had to actually really invest in psychosocial education. When I say psychosocial education, it was actually going into communities and talking about when communities are hit by either a conflict or a natural disaster or a situation which is beyond their coping mechanism. So in that situation, what we look at is that what local coping, cultural coping techniques can be actually brought to the fore. So we don't need to have science borrowed from West. We just need to look at what were the coping strategies when people are at their low. So what we do is like we emphasize a lot on community-based mental health, and we believe community as a healing center. So learning a lot from community, what we also do is we try as an organization to create and hold spaces where people can actually safely talk about their mental health. Right. We also try to see how we destigmatize the concept of mental health, because mental health is not that you have gone insane. It is that you are put in a situation that is beyond your capacity to cope. So having mental health as a part of our programs all around the world is one thing. As an organization, we also recognize that we work in countries around 75 countries around the world, but mainly in countries where the living conditions are extremely difficult, because either a country is going through a war or a conflict or a low intensity strife, and our staff is part of the population. So what we also do is like we make sure that we do care for the caregivers. So duty of care towards our own staff, and mental health is an essential component of it. So caring for your people, because if you cover conflicts, if you cover natural disaster, who is taking care of your mental health? I think that is, let's not only believe that the frontline workers are the medical professionals. It is every professional who is exposed to something that is beyond capacity of, I would say, human tolerance. So that's the aspect I do believe that we should be actually talking on a day-to-day basis and try to see how we integrate it in our narratives. Through your show, how do we talk about mental health and normalize this, that it's completely okay to seek help. It's completely okay to go and see a counselor, a psychologist, a psychosocial worker, a psychiatrist if need be. Timely help saves you from getting into a situation where you may have to then seek assistance or support from a psychiatrist. So prevention is better than cure, and awareness is half problem done.
Beautiful. We are in conversation with Farhat Mantoo, Executive Director, MSF South Asia. We're going for a short commercial break. We'll be right back.
The People's Platform.
ඔබේ ගමේ නගරේ දේශපාලනයේ හෙට දවස සතිය දිනවල සවස 6:30ට.
Solomon, beware the This girl's got poison.
Lita Lisa.
Oh, thank you.
Fortunately for you, I'm one of them.
What is this?
I miss you too.
It's not that easy.
Prefect. Tomorrow at 6:30 p.m. on TV1.
Design is like music. It's a whole orchestra. The dots, the lines, the dashes. It's a whole symphony. It has to feel good.
Come on a fantastic discovery of design as Anthony Burke meets designers from Mumbai to Yogyakarta, showcasing groundbreaking works.
This is me, this is my creation, this is my life.
Culture by design.
Tomorrow at 6 p.m. onwards on TV1.
The People's Platform.
Welcome back. We are in conversation with Farhat Mantoo, Executive Director, MSF South Asia. Farhat, when we look at the world today, we're looking at these hegemonistic, unsustainable cultures. We're looking at a unipolar world where we have prioritized the USA, the UK, Europe, and its allies. Should we not be harnessing the power of the global south, of BRICS? We have so much of resources within our regions, which we are not really utilizing. Equally also, if we look at the bad guys of the world, again, we see the Chinas and the USAs and the Russias of the world, the biggest polluters of the world. How do we make sense of this huge dystopian reality?
There are so many things to actually unpack in your question. So let me start with the last bit first. You spoke about the countries that are responsible for the most in terms of contribution to the climate crisis. And we're talking about countries, but let me actually take you, because we were talking about climate and health, and I think it's important for our viewers to understand this. If healthcare were to be a country, it would be the 5th contributor to the global crisis when it came to climate. So we spoke about US, we spoke about India, Russia, China. Healthcare would be the 5th one. So healthcare is supposed to be do no harm. It's the health professionals, healthcare workers working together for the betterment of people and the planet. So to start with, I think the first step is that what we need to do is build that knowledge gap that is in the healthcare sector on how they are contributing, how they are doing harm while having an oath of do no harm. So I think it's also about how do we educate our healthcare sector on their contribution to carbon, and how our healthcare can resort to more green practices, to better waste management, to look at what is their contribution in the climate and health crisis. So that's one aspect, and I wanted to talk about it because sometimes it appears that we only look at countries. We also need to look at sectors, how sectors contribute, right, and where is our influence as citizens. And I think you as a citizen of this country can ask this question to Sri Lankan healthcare system on how they are preparing and how they have prepared for their contribution to mitigation of carbon footprint. How are they contributing in adapting to the climate crisis? So what is that they are, how they are educating their future generation? How is this integrated in medical curricula?
Right.
I think these are the aspects that we could look at a country level. Now, talking about what's happening around the world, and focusing a bit more on so there is a group of organizations, individuals, civil society movements, even nations that are working on climate justice. So they are asking the countries who have contributed historically to the climate crisis to be paying their share against the countries in South Asia. And you're right in saying so. We have a pool of knowledge, and that is spread in South Asia. These are indigenous people who have indigenous solutions, and they have local knowledge. They know it better how to really maximize on that. But what we have is like it goes back to your earlier questions. You spoke about we have a very siloed approach. So how much do countries in South Asia collaborate, not only at a policy level, but also at a information exchange level, helping each other to build systems? That coordination is critical, and I hope that the South-South cooperation on these things is something that is prioritized. And why only South-South? Why not South-North?
Right.
Because we are only bearing the brunt of what is done by the rest of the world towards South Asia. And then I don't need to remind you or myself that we are one of the world's region that is the least contributor of what's happening to us, and we are the ones who are impacted most. So in that scenario, it's the responsibility of countries in the global north to be able to do their bit in making sure that they alleviate the sufferings and also bring the knowledge. It's not only knowledge, it's also access to technology. It's solutions and their preparedness. How will they transfer that to this part of the world? How would they help innovative models of care that have been developed by very genius minds in South Asia? How would they help them to scale up? How would they really make sure that funding is made available for them? So there is a multitude of strategies that need to be put in place, but all of this needs to be I spoke about it, intersectorial. It needs to be coordinated, and it needs to be coordinated at multiple levels. And one of the things that maybe something we all know about COP. So this year COP30 is going to be in Brazil, and there is something next to that which is called the People's Summit. And I don't know if you are aware about them. So the People's Summit is going to be taken place from 12th to 16th of November 2025, and it's also in Brazil. The expectation is to gather approximately 15,000 people to discuss solutions to the climate emergency from the perspective of traditional peoples, social movements, and organizations with a long-standing commitment to climate justice. So look at South Asia region. How many organizations do we have? How many civil society organizations we have? If all of them come together, they actually could mobilize a movement of change, and that's what we need now.
Farhat, ecological responsibility, reverence towards the environment, these are philosophies that the East grew up with almost before colonization. However, today our policies don't center this concept of ecological transformation. We don't see this in our tenets of development. So as a result of this, our education systems are absent of the prioritization of taking care of the environment, revering the environment. How must we go about inculcating in our children the message that if the earth doesn't exist and flourish, we will not exist?
In these 2 days, we had a session that was an eye-opener in itself, and what you spoke about, actually, I'm going to kind of zoom in to Sri Lanka about it. We had a professor, and I'm going to look at the name of the professor because I do feel by Dr. Fernando. She is a community physician and senior lecturer, Department of Medical Humanities from University of Colombo. And she actually spoke about the climate, health and culture. And in there she spoke about the philosophy, that have emanated from Sri Lanka. And one of the things she beautifully spoke about is, if I can recall it right, she said, climate is a culture metric. So, to illustrate, she actually took us through some different notions of how rains would be an indication of success, how prosperity would be. So how different symbols in Sri Lanka are connected either to environment in one way or the other. So all the solutions are in the nature and in the environment around us. It is just that we have stopped looking at them. Yeah. So so drawing out of it, I would say that there is no dearth of local solutions, and there are many solutions in place. It is just that we need to familiarize ourselves with it, and our roundtable gathering was aimed at actually bringing those voices together. Maybe one more small thing which I do believe is essential for all of us is, how are we learning from each other? Yeah. How open are we to learn from each other? Because it's not about us, it's about our future. Yeah. And I want to remind myself of the keynote speaker today. We had at the climate conference, I think the name of the gentleman, he's very familiar, Professor Mohan Monasinghe.
Yeah.
And he spoke about the environmental debt we are going to leave for the future generation.
Yeah.
And that comes from unethical ethics and practices, which will lead to maldevelopment, and indirectly will contribute to environment debt. So let us not forget how our actions of today are going to influence future of our children tomorrow.
And finally, Farhat, there's a growing call to decolonize aid and amplify local leadership in humanitarian responses. From the side of MSF, how are you rethinking your operational model in South Asia to be more collaborative, to be more rooted in local realities and more accountable to communities?
We are a 54-year-old organization, and an organization that has believed in continuous self-criticism and debate on looking at whether we have our compass right. And over these years, the organization has grown from a movement that was just limited to certain countries in Western Europe to all parts of the globe. So I can say with a lot of pride that the office here in Sri Lanka is a part of that movement. The very fact that we choose to have one of our headquarters in Sri Lanka in South Asia is testimony of the fact that there is no denial that knowledge, experiences can come from any part of the world, and no more the helping hand is from a certain part of the globe. So that is the first recognition. The second recognition is that how we design our programs. Our programs are co-developed, co-designed with the communities, and we have a person-centered approach, which means that we will not be the ones to tell you what to do. You will be the one to tell us what to do. And maybe an indicator, which is a small one, but an important one, is that if you look at globally, we are roughly around 65,000 colleagues all around the world. And out of these 65,000, 90 to 95% of the staff is locally hired staff. So it is people from the communities who are guiding us on the best solutions for the people, and it's not somebody parachuting from different part of the world. The very fact that we have mixed teams, it's for us a demonstration or an expression of global solidarity, because as a medical humanitarian organization, we have two core pillars. One is the medical action, and another one is bearing witness along with the populations we serve. So it is that aspect that enhances our global mixed teams, but majority of our teams are local. And I'm not going to deny, we like any other organization, we have taken our journey, and we are not a perfect organization, and we are in the progress of learning every day. So yeah, we are learning and trying to be a movement that belongs to people coming in from all parts of the world.
When we speak about the importance of collective action for mitigating and adapting to climate change, and when we look at it from a solutions-oriented approach, and the importance of empowering communities to find their solutions, and when we also talk about conscious governments and budgetary allocations, I'd like to bring in this concept of dignity. How can we root our approaches in dignity, in agency? How do we do that? Because oftentimes when natural disasters strike, for example, we in South Asia adopt this very charity-based approach or model of handing over dry rations to these people, feeling sorry or being sympathetic towards the plight of these people. Whereas if we reverse this and root our approaches in dignity and empower these people who are vulnerable and marginalized to be strong and knowledgeable themselves, I feel like we'd be better off.
That would be an ideal world, but nevertheless that should not stop us from doing so. So we are in a region where charity or giving is still intertwined with the faith.
Right.
So giving is an inherent part of our individual existence, and I believe that in many ways it's good, because that demonstrates that you care for your fellow human being. Okay. So nevertheless, the action, how they do it, we could always debate what is the best approach to do that. And within MSF, when I spoke about person-centered care, the whole idea is actually that the person is at the center of what we want to do. So we will have the patient, the community telling us what to do, and we need to actually do something called deep listening.
Right.
Not only hearing the loud voices. So that's different. When I say what is the difference for me, the key difference is that, do you hear the loudest voices, or do you hear in the room all the voices that are not speaking?
Yeah.
So how do you really bring them together? And one of the key things is that, look, we're talking about a reversal of how we should operate. Yeah. And the starting point is to actually make sure that you and me can have a conversation if we have a level playing ground, and we do not have a level playing ground. That's a starting point. So how do you bring people up to that level first? By giving them all the necessary means to be able to do that. So at MSF, what we try to do is, like, our locally hired staff is critical in our decision making. They are the ones who will guide us on the best approach. But it is also that we don't limit ourselves to that. We engage in the community to see what are the voices in the community that we need to hear.
Right.
So to bring back agency to people, there is one thing that is critical for us. It's the dignity of care. And sometimes we are asked that, oh, you're such a big organization, you could go and do 10 interventions. It's not about saving 1,000 lives. It's sometimes saving one life. So for us, many places around the world, we have gender-based violence projects or reconstructive surgery projects. These are not life-saving projects in a way that if you want to save people, they will die. But the choice of doing those is because you enable dignity through that process. Yeah, you could ask somebody who has a deformity because of a war or so, by doing correction of that deformity, they get a quality of life that brings dignity to them. So our small endeavors are in that direction, but it's a long way to go.
Thank you very much for this conversation, Farhat Mantoo, Executive Director, Médecins Sans Frontières, Doctors Without Borders, MSF South Asia. Thank you for this conversation.
Thank you very much.
Thank you for watching us. We'll see you again next Friday. Good night.